Mad honey is one of those natural substances that sits at the meeting point of tradition and modern medicine. It has been used for centuries in small amounts by communities in parts of the Black Sea region, the Himalayas, and surrounding areas. Long before laboratories and clinical trials existed, people observed its effects, learned its limits, and passed that knowledge down through generations. Today, medical science approaches mad honey with a similar mindset, not through fear or hype, but through careful moderation, observation, and context. From a medical perspective, mad honey is defined by what it contains. Certain species of bees collect nectar from rhododendron plants that naturally produce compounds called gray anotoxins. These compounds interact with the nervous system and cardiovascular system. In high amounts, they can cause symptoms such as dizziness, nausea, slowed heart rate, and low blood pressure. This is well documented in medical case reports, but science does not stop at identifying risks. It also asks a deeper question: under what conditions do these effects appear? And why have some populations used this honey for generations without widespread harm? This is where moderation becomes central. In toxicology, there is a well-known principle: the dose makes the poison. Many substances that are harmful in large amounts can be neutral or even beneficial in very small quantities. Caffeine, alcohol, and certain medications follow this exact rule. Mad honey is studied through the same lens. Researchers look not only at what it can do, but at how much is consumed, how often, and by whom. Traditional use provides valuable context for this research. In communities where mad honey has a long history, it was never treated as a regular sweetener. It was used sparingly, often measured by a spoon tip or a few drops. Elders understood that more was not better. This cultural knowledge acts as an early form of risk management. Modern researchers pay close attention to these usage patterns because they offer real-world data collected over centuries, not weeks. Medical science evaluates balance by combining laboratory analysis with clinical observation. Honey samples are tested to measure gray anotoxin levels. These levels can vary based on geography, season, and plant species. At the same time, doctors analyze patient reports from hospitals to understand how symptoms correlate with quantity. Patterns emerge consistently. Severe reactions are almost always linked to excessive intake or lack of awareness about potency. Another important factor is individual context. A healthy adult does not respond the same way as someone with heart conditions, low blood pressure, or who is taking cardiovascular medication. This is why modern medical advice rarely labels foods or substances as universally safe or dangerous. Instead, guidance is personalized. Moderation is not a fixed number. It depends on the person, their health, and their environment. Scientific research also examines why people continue to be drawn to natural products like mad honey. Part of the answer lies in the human desire for balance rather than extremes. Many traditional practices were built around observing subtle effects rather than dramatic outcomes. Small amounts were used to support digestion, circulation, or general well-being, not to chase strong sensations. Medical science respects this approach because it aligns with modern preventative medicine, which focuses on long-term health rather than short-term impact. Importantly, studying mad honey does not mean promoting its use. Medical professionals are careful to separate understanding from endorsement. The goal is education, not encouragement. By understanding how moderation works, healthcare providers can give clear advice, prevent misuse, and respond effectively when adverse reactions occur. This approach also helps remove fear-based narratives. Sensational stories often focus on extreme cases, ignoring the context that made those outcomes possible. Science looks at the full picture. It asks how often problems occur, under what circumstances, and how they can be avoided. In the case of mad honey, the answer consistently points back to moderation and informed use. In a broader sense, mad honey serves as a case study for how medicine approaches natural foods and traditional substances in general. Rather than dismissing them or glorifying them, science examines them carefully. It measures, observes, and compares. It acknowledges that nature is complex and that understanding comes from balance, not absolutes. As research continues, the focus remains steady and cautious. New analytical tools improve accuracy, but the core principle remains unchanged. Knowledge grows when curiosity is paired with restraint. Whether studying honey, herbs, or any natural product, moderation is not a limitation. It is the foundation of understanding. Subscribe for trusted, science-led explanations of traditional practices.